Right, morning everybody. I'd like to welcome you to our Atrial Fibrillation Symposium, and I'd like to start off by thanking all our sponsors who have made today possible. So we've had some fantastic sponsorship from our partners across the region, and just right at the beginning of this event I'd like to say a big thank you for working with us throughout the project and then sponsoring this learning event. So I'm Liz Mear, I'm Chief Executive of the North West Coast Academic Health Science Network, and you'll see from the first slide that this is a joint event with Greater Manchester, South Cumbria and Lancashire Clinical Network, and I'm going to talk more about the work of the Clinical Network as we move through the presentation. So I'm going to tell you a bit about Academic Health Science Networks, tell you what we're trying to achieve, and also tell you about the clinical networks and how we work together, and how on this project we've worked with a really wide range of partners to achieve the fantastic results that it's achieved. Now, before I start, I just want to take a straw poll of you all. Who's here from the NHS, please? Yeah, ooh, lots of people, wow. Who's here from industry? Yeah. Who's here from universities? Oh, excellent. And have we got any service users who are here that obviously are affected by all these institutions but are here because they're a service user wanting to find out a bit more about what's gone on? Yeah, thank you, thank you. So I think we've got a real mix of people in the room, and that reflects what we try to do as Academic Health Science Networks. We work across innovation, trying to get innovative products and techniques into practice. We impact on health and health inequalities, and we promote economic growth in regions by matching our fantastic businesses who have got great products that can impact on health with our NHS and other public sector partners. And we work with our local universities on evaluation, looking at what's the best evidence for issues we want to put into practice, and really having that triple helix approach to making health safer and healthcare improved in the country. So there are 15 of us across England, and the point of the networks is to spread learning. So whatever we do in this region, we try and spread across the country through the networks. And AF actually is the one subject that nearly every Academic Health Science Network has picked up on because of its capacity. Can't you hear? So we cover an area of Cheshire, Mersey, Lancashire and South Cumbria. Last year we ran a stroke and AF campaign in Cheshire and Mersey, and we held a similar sort of learning event as today, and obviously we wanted to cover the whole region, so this year we've worked with Lancashire and South Cumbria organisations, and we learnt some lessons from rolling the campaign out last year. It was very successful, but obviously when you're working through these things we learnt some lessons from that which we've been able to apply into this geography. So our AHSN Vision, we're all about changing culture, getting people to think differently, getting them to adopt new things that will impact on healthcare. Spread at pace and scale, taking people through a journey about how to change their mindset so that we can change NHS care and improve it. So we've taken a three-pronged approach to the Stroke AF campaign. One is learning, so events like today, how can we learn from what's gone on and improve practice? One is using simple technologies that are easy to use for practitioners or for service users, and you'll see lots of those demonstrated around the room. And we fund some technologies, we encourage development, we pump prime purchase of them, and you're going to hear a bit about that later on. And the other is involving residents in the campaign. Obviously we've run out a testing phase of a campaign, but how can we involve people to make it meaningful? And we've done a lot of our testing in local football clubs because that's where families like to go. People will go there rather than go to a health setting. So we've really tried to find venues that are attractive for people to go to and encourage them to come along to test to see if they've got atrial fibrillation. So our partners, the clinical network, they are also about spreading good practice at pace and scale, and you'll see that we have Cheshire and Mersey, who we worked with last year on this, and Greater Manchester, South Cumbria and Lancashire. And we overlap on a number of areas, but we do different things within those areas. So the SCN has been developing a commissioning toolkit that's in draft form to roll out to commissioners. So we've taken different roles in this campaign, but working together has made it successful. So this is my diagram that I like to show about working together. And if you look there, the ants have made the bridge. So they've all got a different role. They all work closely with each other and they create a bridge for new ideas. Well, they don't create a bridge for new ideas, but it's an analogy for us creating a bridge for new ideas, working with different partners and being closely linked so we achieve the aim we want to achieve for residents and for business and for improved healthcare. And like I said, in this project, we've had industry, we've had residents. UCLAN have been working with us on the psychological support for people after stroke. And it's been a really successful model and one that we would hope to replicate for lots of other different technologies and conditions. So about us shaping the future together, and we hope from today that we've got an opportunity to take that even further by pulling together your ideas in the panel session and thinking about what good practice we can start to roll out after this event. So as an HSN, this is our plan on a page for this year. And it looks incredibly busy, but if you look down the green block in the middle, this is our cross-cutting work streams and things that we think sit under every clinical or academic or different pathway that we might serve for the residents. So the stroke AF, we think it's prevention and early detection of the disease, system integration. It reduces health inequalities by bringing people into venues that they will come into to be tested. Use of technology, lots of simple technology products deployed on this, procurement, working with people to get them procured, developing an innovation culture, doing things differently and seeing that it's okay to do that, working in partnership, deploying digital health, supporting local businesses involving residents. And we have a stream of this. It's about precision medicine, about looking at warfarin dosage for people by looking at the genome type. So actually for us, this project cross-cuts across everything we want to achieve. Likewise, our colleagues in the Strategic Clinical Network, these are their areas, and I think this impacts on preventing people from dying prematurely. If we can detect AF and treat it, we can stop them having a devastating stroke. Ensuring people have a positive experience care that meets their needs, not the needs of the NHS, and caring for people in a safe environment. So how does that all relate to today? So these are our aims for today, which I think really I've sort of encapsulated in what I've been saying to you about how we move forward and how we debate issues relating to this topic so that we can bring more good practice to bear on it. This is our what we've been doing, the summary on a page of what we think we've been doing. So identifying AF, managing care pathways, bringing innovative technologies to bear, and sustaining and spreading is the next stage. How do we carry on with this approach? How do we spread it across the country with partner HSNs and clinical networks? And I'd just like to finish bringing this right back to the level of the residents. And just thinking about some of the things that we've heard. So some of you might have heard me talking about this before, but we have somebody that we talked to who's got AF, and for the purposes of what I'm going to say now, we'll call him Bob. He's not called Bob, but I'll just call him Bob. And Bob's had AF for years. He's a retired gentleman. He likes to go on holidays. He likes to live his life to the full. And having AF has really prevented him from doing that because he needs his blood testing. He has to go into the anticoagulation clinic, sit in the uncomfortable chairs for ages to wait for the test. So he found out that he could self-manage. And he was really excited. There was no funding for the kit, so he bought the kit himself. But the CCG told him they'd pay for the testing strips. So he thought, right, okay, I'll invest in the equipment, they'll buy the testing strips. When the equipment came, they wouldn't pay for the testing strips. He thought, right, that's fine, I'll invest in the testing strips. So he tested his blood, managed to do it, fairly complicated, but managed to do it. And he emailed into the anticoagulation clinic to say, this is my reading. They contacted him and he said, could you email me back to tell me what dosage of warfarin I need to take based on that reading? And they said, oh no, we can't do that. We need to send you a letter. So straight away, I thought, well, how can I go on holidays for any long period of time? So they needed to send him a letter. So he wasn't very satisfied. He'd rung the CCG and he asked them how much it cost to run an anticoagulation clinic. The testing strips cost £60 a year. Did it cost them more per head of population to run that clinic? They wouldn't answer his queries. So we know we've got people in this room who have technologies that allow him to self-test and also an algorithm to allow him to self-dose, but NICE, the body that approves healthcare technologies, NICE will support self-management, but not self-dosage. So actually everything was conspiring against Bob, and still does conspire against him. So I would think one of our things we can do in this room is to start to put pressure on to treat people as people, not patients. So how can we empower them? How can we work with the system to try and roll out a new approach for people in the region? Thank you.